Hello and welcome to Principles and Theories of Healthcare Games Applied to Biomedical Informatics. This presentation is a result of a collaboration between Joseph Plasek, Seth Russell, and Nicholas Lee. I, Seth Russell, will be your narrator. Here's a brief overview of what I will be covering. First, I will talk about some of the background theories of games. Next, I will talk about health behavior change techniques and learning modules. Then I'll review some community-based intelligence healthcare games. And lastly, I will review a taxonomy of healthcare games. Now, let me provide some background theories that apply to games. Coopetition. This is a theory that is based on principles of game theory and decision theory in which actors who normally compete against each other cooperate to achieve better outcomes compared to outcomes without cooperation. This is commonly applied in games. Game designers find ways for actors, players, to both compete and cooperate to maximize enjoyment. Gamification. Gamification is a model and method by which user activity and retention in an activity are improved by combining game design elements in a non-game context. From the computer science and graphic design fields, experts have identified key ingredients in digital games. Gamification applies those key elements such as avatars, time constraints, feedback, ranks or levels to traditionally non-game contexts. The end result is to understand and engage people through both intrinsic and extrinsic factors, as well as how interest changes over time. The image in the bottom right of the slide is from Foldit and shows some gamification principles applied to a protein folding game. For more understanding of these theories and how people interact in virtual worlds, please review decision theory and a field called game theory that is studied by economists, psychologists, and others. Now, I will move on to learning and behavior change methods that are at the core of games that are not designed for entertainment, but are designed as learning or training simulations. These type of games are called serious games. The Interactive Computing Complexity Learning Model is an integrative information processing learning model that views learning as the result of complex and nonlinear interactions of variables that are both internal and external to the cognitive system of a learner. Notice that the effects component of the module includes motivational variables in addition to attitudes, emotions, and self-efficacy. Now, let's dive into some of the theories behind motivation. In the modern information age, the greatest hurdle to learning has become finding the motivation to learn. When education or training feels dull, we are not being engaged and motivated. In other words, we're not really learning. Used for learning, well-designed games are able to cut through distractions and engage this audience in a way that few other methods can. Behavioral theories tend to focus on extrinsic motivation, that is, rewards, while cognitive theories deal with intrinsic motivation, that is, goals. Most behavior change theories view motivation as a result from physiological drives and the rewards that fulfill them. Developed by psychiatrist William Glasser, choice theory states we are motivated by a never-ending quest to satisfy the following 5 basic needs woven into our genes: to love and belong, to be powerful, to be free, to have fun, and to survive. Games have the obvious ability to help people have fun while learning, while sometimes fulfilling some of the other needs as well. The challenge then is to create a learning environment that fosters the expectation and desire to learn inside every student. To create this intrinsic motivation, the teacher needs to engage the player's needs to overcome challenges, explore fantasy, and have curiosity in a subject. Providing a challenge for the learner should help them form goals that will lead them toward mastery of the subject. It should give a sense that there is still more that needs to be done. However, it should not be too challenging because studies have shown that in general people prefer tasks of intermediate difficulty. This means that ideal tasks are not too hard and not too easy. Intrinsic motivation also requires an element of fantasy. Not idle fantasy, but freedom to express incomplete models of the world without being limited by reality. In other words, simulations test the models learned. This is what children do when they play house or make-believe. As scientists, we also create simulations of new concepts in order to test and understand them better. Then there's curiosity. No one will feel the need to continue learning about a subject if they feel they know everything there is to know already. The learner will only have motivation to learn more if they believe there is more to learn. That is why the learner needs to feel that their knowledge is incomplete or inconsistent with reality. For example, a child may be motivated to learn more about fish if they learn that some fish can breathe outside of water, like the mud skipper. Now, as an example of how these theories I have been discussing have been used, we'll look at Escape from Diab. Escape from Diab is a serious video game adventure in healthy eating and exercise that incorporates a broad diversity of behavior change techniques woven in and around engrossing stories. On the left is a table presenting components from 5 different behavior change methodologies. On the right is a model for behavior change. The big question is, can games change behaviors? Results from a Baylor College of Medicine clinical trial showed that children who played Escape from Diab increased their fruit and vegetable intake by a full serving a day and were physically more active than those visiting traditional health websites for kids. These behavior changes are comparable to or better than those reported in the literature with children. Results indicate that yes, Escape from Diab can in fact change patient behavior. We've looked at healthcare games with a direct effect on the patient. Now let's look at a different class of games, games that are designed to improve consumer health information and medical literacy of patient populations. Some of you may have heard of Dr. Jeng and others' work here at the University of Utah Biomedical Informatics Department in automating the conversion of discharge instructions into pictographs that are easier for patients to understand and remember. While some initial glyphs were created by artists, the task of creating and evaluating the large number of needed glyphs was too much for one person or even one team. In order to solve this problem, they created a web-based game called Doodle Health. This game allows users to create and evaluate glyphs to determine which would be the most effective for patients. Let's take a closer look at theories and potential concerns behind crowdsourced gaming solutions. So, to better explain how Doodle Health works, let me briefly talk about what crowdsourcing is. The basic idea behind a crowdsourcing platform is to break the task of interest into smaller pieces that can be completed in a relatively short amount of time. Then distribute these pieces of a problem to individual humans through a convenient medium, such as the internet. Lastly, combine the collective responses of the individual participants to yield an optimal solution. How does this work? Shouldn't we only allow experts to solve our healthcare problems? One line of literature emphasizes knowledge-related benefits, suggesting that drawing on a large and diverse base of knowledge, skills, and pre-existing solutions can increase the likelihood that a given problem is solved, reduce the time required, and lead to more valuable outcomes. A second line of work suggests that involving the crowd can yield motivational benefits in that its members are often driven by different motivations than workers in traditional employment relationships and may be willing to work for lower pay or even for free. Lastly, it is possible to make use of the inborn pattern recognition capabilities of humans to solve tasks that would be difficult and time-consuming to solve by computers. As we've reviewed in this class in previous modules, a human plus a computer is better than just a human. What many have found is that by adding more people, a crowd, the benefit is even greater. While it is possible to involve more people in an entertaining way to solve problems, one question arises is how do you validate the solution? One common approach that is used in other areas, such as statistical modeling, is to take a part of the dataset and have human experts, such as nurses, physicians, biologists, etc., depending on the problem domain, provide a solution and then compare their answers to the crowd decision consensus. This can be done by a simple majority or by more complex statistical methods. As an example of more complex methods used in malaria diagnosis game, this formula shown here uses Bayesian statistics and treats the gamers as if they were a repeater in a noisy telecommunication channel. While crowdsourcing has its place, some may have concerns about this methodology. Let me address some of the common concerns with crowdsourcing. The basic gist of this issue is that we rely on experts so much, why should we trust non-experts? The quote shown here from The Hitchhiker's Guide to the Galaxy sums up many people's view of the likelihood of getting a quality result from a crowdsourced solution. The first area is privacy concerns. These concerns include items such as, my personally identifiable information should only be accessible to my healthcare provider. No, this problem is no different than that faced by all healthcare analysis problems, but the scope is broader due to the unknown nature of the participants providing the analysis. So one solution is to use publicly available information such as what is found on publicly available internet forums. Another solution is to use de-identified data, for example, images of cells that are not labeled at all from the game player's perspective. The system knows what image is presented and is able to tie that back to a unique record. The next area is that of diagnosis quality, or can I trust a non-expert to provide an answer? In crowdsourcing, depending on how the game or solution tool is set up, the person providing the answer may be completely anonymous. There is no two-way communication with gamers, so how do you know they are providing a good solution? This is addressed through statistics and the use of known values, such as gold standards or expert reviews. While these concerns are valid and must be reviewed with every solution, it has been proven that non-expert crowdsourced solution can match experts if the problem is properly framed and the results are reviewed. Take, for example, the case of biomedical image analysis mentioned on the previous slide. In the area of telediagnosis, researchers were able to create a crowdsourced solution for malaria diagnosis in which they achieved an overall accuracy of 98.13%, or 98.78% of cells labeled as healthy, and 76.85% of cells labeled as infected were in fact correctly labeled. So in this case, the crowd was within 2% of the experts. Informaticists love to organize information, so here's a proposed taxonomy for healthcare games and different areas in the medical field where they would be or have been shown to be useful. Let's look at a few examples from this taxonomy. Of note, the taxonomy includes applications within a personal health record or electronic health record, perhaps through the application of patient engagement and persuasion analytics methodologies. According to the Gartner Health Analytics Hype Cycle in July 2014, a new area of patient engagement and persuasion analytics was on the rise. This new area could benefit from adapting game methodologies. Primarily, education and information for the patient are among the most important elements for improvement, and not just more, but more precise and relevant information. Beyond this, motivation is a powerful tool that can be used in the patient engagement process to help persuade and inspire improved patient behaviors. As another example from the taxonomy, a particularly interesting case in terms of public health informatics is from the popular MMORPG World of Warcraft. The Corrupted Blood incident, where a glitch caused an epidemic or virtual plague, where a spell intended to only last a few seconds and function within a new area, soon spread across the virtual world, resulting in a pandemic that quickly killed low-level players and drastically changed normal gameplay, for example, quarantines, abandonment of densely populated cities, etc. As a final example from the taxonomy, healthcare organizations and medical schools use games and virtual reality simulations for teaching a variety of tasks. One such task is retraining advanced life support providers, where the game has been shown to improve retention of knowledge when retraining skills, and is something that providers would be willing to use between formal training sessions. This table shows how game-based learning incorporates the major advantages of both traditional lectures and hands-on training. Game-based learning is cost-effective and low risk, unlike, for example, safety training using actors, or even worse, real patients. Perhaps even more important, there are significant learning advantages. Learners can reenact a precise set of circumstances multiple times, exploring the consequences of different actions. In addition, well-designed games permit learning experiences that aren't possible in real life. Games represent an active, realistic learning environment. The focus is on learning, through consequences, to apply the right knowledge at the right time. Games can also be done on demand, meaning providers can use them at their convenience without having to wait for a formal class to be scheduled. In conclusion, we have covered just a brief overview of the area of games for healthcare. This is a rapidly growing space, and there are many other examples and uses of games to help with healthcare and biomedical informatics problems, such as the games shown here. Thank you for your time. If you have questions, please post a voice thread or reach out to Joseph, Nicholas, or or Seth personally.